Hello, my name is Clark-Reyes, and I will be simulating today a wound care dressing change with irrigation and packing. That's a lot to say. Just to show you before we actually begin, I gathered all the supplies here because I don't have a lot of room. So when you see me reach over here, just like I pointed out, here's actually the wound. I have my irrigation over here, my measuring tools over here, my sterile gloves. When you see me pull this out, here's my dressing tray, my sterile dressing tray, fluid, and biohazard bag. So I'm going to attempt to fit it here. So we'll go from there. So before we begin, or when we start, we would perform hand hygiene, provide patient privacy. We would introduce ourselves. We would use 2 patient identifiers. They will give you your name, date, and date of birth, and then you check their badge. You check for any allergies. You do your environmental safety check. You ensure proper body mechanics for your safety and the patient's safety. You gather all supplies, which I have done. We verify the MD order, and once we have done that, we verify the MD order, then we do the patient education to tell them the need and the rationale for the actual procedure. So now we're going to start. We've done all our pre-checks, which we pretty much do with every single patient. So now we do the assess, where we assess the wound. So, actually, before we assess the wound, we ask them about their pain, which is PQRST. P stands for provoking factor, Q is for quality, R is for radiate, S is for severity, and T is for timing. So if after we give them the patient education, we ask them where their pain level's at, what's going on, PQRST. If they say they do have pain, then we try to administer pain meds 30 minutes before the actual procedure. That way, just provide comfort for them. So they say they have pain, 7 out of 10. Okay, everything over 6, we give meds. So we give them the medication. We come back half hour later. It's a half hour later. So now it's time to assess. So now what I'm going to do again before I start, I wash my hands, I don gloves, and this part right here is just a clean technique because we're just going to remove all the old packing from there. So when we assess, so when we assess, we remove the old packing. So when we remove the old packing, it should say the date, time, and initials. So when we put the packing back on, we do that. So remove the old packing, we just get it, dump it right in the bag. I hope you can see that. So then we remove all the soiled spots. And we just dump it right in the bag. So actually what this is, the apple with seeds in it. Anyways. So what we're looking for when we're assessing this, it's called COCA. It's called COCA, which COCA stands for the color, the odor, the consistency, and the amount. So right here we assess the wound edges, the wound bed, so that'll be around it. We're looking for granulated tissue, exudate, eschar, slaw, edema, infection. We're looking for any of that. So what we do here, now we have to measure. If this was the leg here, let's say lengthwise, We always measure from head to foot is the length. Head to foot, so let's pretend the head is over here. So we measure head to foot is the length. So we would actually this will come in our equipment where we could throw it away. So we always measure by centimeters. So the wound is about 6.5, and we always measure at eye level. So when we measure width, it's left to right. So again, head to foot is length, left to right is width. So 6.5 one way, and then 5.5 width. So when we measure our depth, we use a Q-tip. And the way we do that, we reach the most deepest point. We stick the Q-tip, obviously not stabbing them. And then we keep our finger on there where it's at. And then we just measure where it's at. So that's about 2.5 centimeters. So that we dispose of again biohazard glove or biohazard bag. There's also something called undermining, which I didn't simulate it here, but undermining is when there's tunneling. Undermining is when there's tunneling or it's going underneath the skin. So if this was a skin overlapping, it'd be that you could actually go in there, or again, if it's tunneling and actually going somewhere else. So now that we have all the measurements and we have them written down, we dispose of everything. Everything goes right in the bag, which this I'm not going to dispose of because it's still good. But normally in any situation, we dispose of this too. So now we're getting set up for the irrigate the wound. So now to irrigate the wound, obviously we have our fluids in here. We're going to simulate that we have our fluids. So when you irrigate the fluids, you only irrigate in one direction, and you irrigate until the solution runs clear. So once it's running clear, and then we have to, when we're irrigating, we have to remove any extra debris. So we'll clean around, we'll clean on the inside. Again, when you irrigate, you only irrigate in one direction until it runs clean. So there, we're irrigating, we're running it, we're patting it dry, we're cleaning it. So again, dump it whenever you're done. So now that we're done irrigating, we would run, before we put it away, we would actually obtain a specimen sample for the lab. And one thing with specimen samples, label correctly. So now we're going to the actual next step, which right here we're done. So we're going to dispose of everything, dispose of our old gloves. So the site is clear, clean. We've collected our sample, we've assessed it, we irrigated the wound, we collected our sample. Now we're going to start the sterile part of it. So we're going to wash our hands again per CDC guidelines. We're going to prep the sterile field. So in order to do that, when you try it. So when we open this, you will actually see how it says sterile field there. So we have to keep in mind our 1-inch border. So it's telling us there that 1-inch border is there. So we only pinky it, you know, get the pinky, but you only pinch it from there. And again, you have to keep in mind the sterile field. And I can't move the camera. You're gonna keep in mind the sterile field. So again, you're allowed to only pinch the 1-inch border, and then you're going to lay your sterile field down. And I'm very limited on space. but you know, it's a good test. Okay, we're gonna pretend it's supposed to be flat. Okay, so now we have our items there. And once you have your sterile field, you do not cross with contaminant, or you never turn your back on it, or else that's breaking sterile field. So then I would don, well actually, this, because it is still sterile, I put it, palm it underneath, and then I'd make sure to put this in the center, keeping my sterile field intact. And you make sure not this plastic to, nothing touches that except for what's inside here. So this is done with right here, goes in the biohazard. So now everything in the center is clean. Again, I can't turn my back, and I can't cross-contaminate by having something hover over it. I gotta keep my 1-inch borders in place. So now I'm gonna don my sterile gloves. So this is simulating donning sterile gloves. Already done that video. Save time. Okay, so now I have my sterile gloves. So now what I need to do, I need to repack the wound. So when I repack the wound, I have to be careful not for the sterile gauze to touch the edges of the wound. So I will very carefully manipulate both of these. Again, this is all sterile. And if you need to be careful and only use one, only use one. If you hear a weird noise, that's because it's my dog behind me. So again, if you need to add fluids, you should have added fluids before. But we're gonna add, there you go. We're almost basically just gonna drop it on top, and then with a sterile Q-tip, but basically stuff it. But again, to make sure the sterile doesn't touch the outer edge. So pack it nice and good. Okay. So that looks like a really good packing actually. So now what we're gonna do, we're gonna secure the dressing. So it's right here. So we're gonna throw it on top. Okay. So we tape on one side, tape the other, tape one side, tape the other, and we secure it. And when we put the last piece of tape, we write down the date, time, and our initials. And then what we do at the very end, we get rid of, dispose of all sold items. So this is already secure, it's already good to go. We dispose of all the items. We double check for a safe environment. We put the bed in the low position with the rails up, and safe environment, make sure everything is off where it's supposed to be. And then we wash our hands per CDC guidelines. We check with the patient one last time before we leave the room. And that's how we do a wound care dressing change with irrigation and packing. Thank you for your time.